Hi, we're back. Well, that went fast. I'm excited. I'm just excited to be here. I'm excited to be anywhere. Maybe soon we can do this in person. I don't know. Can you even imagine though, really? Like what would we wear? How long would it go? How many times would we eat? We are back. Next, we're going to welcome to our virtual stage Beth Nagel, Senior Deputy Director of Policy, Planning, and Operational Support Administration with MDHHS, who will give an overview of the Health Information Technology Commission, yes, and provide updates on their progress related to creating a 5-year health information technology roadmap. Beth, I was able to join the Health Information Technology Commission meeting I guess it was a couple weeks ago. Thrilling. There's so much going on. Tell us, please.
Joanne, I love your enthusiasm. You may be the first person to say thrilling.
For the HIT Commission?
With any sort of governmental commission.
I begged to go. They finally had me. I asked if I could stay. They were like, I think it's enough. Thank you. All right.
Now, I was there and that's not true. We welcomed you back because we loved your enthusiasm.
Tell us more, please. And thank you for being here.
Absolutely. Well, thank you so much for that very kind and gracious introduction. As Joanne said, my name is Beth Nagel. I'm with the Michigan Department of Health and Human Services. I'm actually going into my 18th year with the department. And I started out early in my career actually working on health information technology. And a fun fact is that I was the first staff person to the Health Information Technology Commission. So it's been really exciting to kind of, I took a brief pause in the middle of my career to work on some other things within health policy. And so it's been really exciting for me to come back and work on health information technology. So with that, I said I've been at the department for a while, but I've really just been in this role for several months. And so it's been really exciting to see all of the progress that has been made. So with that, today, I'm just going to talk a little bit about the Health Information Technology Commission, how it started, why it started, its primary functions, and then kind of what we're up to right now. And so with that, I can go to the next slide and just talk a bit about the history of the commission. In 2005, the governor at the time, Governor Granholm, really wanted the state to be on the cutting edge of health information technology, to really use technology investments to make our healthcare system the most efficient and effective in the nation. And so with that, the governor brought at the time, it was the Department of Community Health and the Department of Information Technology. Both of those department names are outdated now, but at the time, those two entities come together to really explore what can state government do to promote health information technology throughout our healthcare system. And so as the departments kind of came together and explored what models we could look at, what some other states are doing, what other countries are doing to promote health information technology, in 2006, the legislature kind of put some structure around kind of the progress that we were making, which was really helpful. They created the Health Information Technology Commission. And it's in state statute. And so we'll talk I'll go through a little bit more of that state statute and kind of what's all in that. But what's really important is that at the same time that the legislature kind of codified what it means to be on the HIT Commission, also made a tremendous investment of $10 million to support health information exchange. Around this same time, the federal government also made a tremendous investment, about $15 million in Michigan as well, for the same goal. And so from 2006 to 2010, the HIT Commission worked on what is called the Conduit to Care report. And it was really our first roadmap for health information technology in Michigan. Really envisioned Michigan going from paper to HIT, making that big leap in changing our practices and how we do business in the healthcare setting. And so It was really foundational and groundbreaking at the time, and really is what is the plan that we worked off of until about 2019, when the HIT Commission looked at the report and said, you know what, we have achieved much of the vision of this report, and where we haven't achieved, maybe we need to refine. And so really contemplated coming back to the drawing board and making a new plan, a new roadmap for HIT in Michigan. And so I will actually spend the largest portion of the presentation today talking about how we've done that and where we are in the process, and a little sneak peek of what's in the roadmap so far. On the next slide is straight from the statute that created the HIT Commission. And I won't go through all of these, but it lists what the commission shall do. And it's kind of a really regular, normal list of what government commissions should do. But I will note, kind of in the middle of the slide, I think it's in black text, it says develop and maintain a strategic plan. And so that really is this activity that the HIT roadmap that I'm going to talk about in a couple of minutes really falls under that activity. On the next slide, is part 2 of the list of the statutory activities for the HIT Commission. And I will note that the Commission's primary function is to make recommendation to the Michigan Department of Health and Human Services. But I also want to point out at the very bottom, the last activity is making recommendations to the legislature. And part of the Commission's duties is to annually make a report to the legislature to bring forth recommendations and considerations that the legislature might make to state laws going forward. So the commission has a big role to both advise and bring recommendation to a state department, but also to the legislature. If you look at the next slide, another bit of the state statute that created the HIT Commission, you can see that there are 13 boxes. Those 13 boxes represent the type of representative that should be on the HIT Commission. It is the governor who makes appointments to the HIT Commission, and that the governor does so within each of those categories. And right now I am serving as the Michigan Department of Health and Human Service representative. Okay, on the next slide, you may have noticed that another one of what the duties that the commission may have is to create advisory committees. And so on this slide, you can see we have 3 running right now for adoption, expansion, ideation, and governance, and many great ideas and recommendations bubble up from those committees. On the next slide, I want to talk about kind of how this really is how we decided to embark on this new HIT roadmap. We had 2 goals, and it's to look at the short term, right? In the next 5 years, what do we want to, where do we want to go in the next 5 years? What do we want to achieve? What sorts of partnerships need to be made? What sorts of regulation might need to be crafted to really support the next 5 years of HIT in Michigan? But then also what we really learned from that previous process that happened, the 2006, 2007 that created the Conduit to Care, is that we need a way to constantly update, to have a document that doesn't, just plot out one path, but is constantly being revised. And, kind of a process of iteration was really important to the HIT Commission. So not just to have, to look at the next 5 years and then maybe in a couple years look at those next 5 years, but to kind of always be on a path where we're updating. On the next slide, then, I will get straight into where we are now with the 5-year health IT roadmap. And so I'll just go right on to the next slide. We received a grant from the Michigan Health Endowment Fund to take on this process. And we engaged with a group called Cedar Bridge, and they have been our consultants for carrying out this work. And so the very first thing that the HITC Commission asked for was to make an environmental scan to kind of tell us, do what we needed to, whatever research needed to be done, whatever fact finding, to be able to answer what is our current state. And then not just take that, this is kind of the next important part, and why I think this process is particularly interesting, is that we didn't just take the environmental scan and kind of make decisions from that. There was a process of validating those findings with stakeholders. And so what we were able to do was to say, based on what we know, here's what we think, our current environment looks like. But we wanted to ask stakeholders, is this what you're seeing? Does this make sense to you? Is this, how you see the current environment that we're in? And so that process then created recommendations. And so this is kind of where we are right now. I'll show you a timeline in a minute, but just for the purposes of this slide, we are at the creating recommendations stage. And so the recommendations, kind of were brought forth by the environmental scan and the stakeholder validation. And now we are in another process of getting stakeholder feedback on those recommendations. What comes next, where we'll go right after that, is for the HIT Commission to prioritize those recommendations and then determine implementation, to really talk about what those next steps might be. So on the next slide is kind of just a little bit of the timeline. You may have mentioned that I said that the HIT Commission said in 2019 that they wanted to update the HIT roadmap for Michigan. And unfortunately, we did have some setbacks due to the COVID pandemic. So the work really started in Q3 of 2020. And so it was in that timeline of Q3 and Q1 of 2021, where we did the environmental scan. We looked at everything that had happened in the recent history since the first report, the Conduit to Care, had come out, and then worked to get the RSC stands for Roadmap Steering Committee. I had to really work to come up with that, to figure that acronym out. But the Roadmap Steering Committee was really important, made up of some HIT commissioners and also stakeholders, to be able to say, to continually steer the process forward, to be able to say, you're on track with this, or you're kind of off track, with this. And so that was very important. Regular updates were provided to the HIT Commission during that time. If you move forward to the, not on the slides, just on this slide, move forward to Q2 and Q3. I'm sorry, I told, yep. There we go. The draft roadmap was then given to the HIT Commission for consideration, and then a process of stakeholder feedback and validation has gone on. And really, we're just coming out of that and making revisions based on that stakeholder feedback. What this slide should say, where it says October, November 2021, should really be Q4 of 21 and Q1 of 22, which is when we will finalize the roadmap for the HIT Commission. That's our goal. And then that gets forwarded on. As the HIT Commission is a recommending body to the Department of Health and Human Services, this report then will go to the Department of Health and Human Services. So now I want you to move on to the next slide. So this is just kind of a rolled up list of the types of stakeholders that were involved in the validation and the feedback process. What's really interesting for me here is the different kinds of stakeholders. From my context of having participated in the very first Conduit to Care process, which had over 200 stakeholders involved from all over the state, I can tell you, I don't think we had social services organizations. I don't think we had EMS at the table. And I'm not sure to the extent we had consumers at the table. So having these stakeholders in the process now, I think, speaks to the progress we've made in Michigan and kind of the direction we want to go to bring in more types of data that tell a picture about the whole person in our health information exchange. And so, I think it would have been impressive to list out all the different kinds of stakeholders, but perhaps take too long. This is just a rolled up list that gives you a flavor of who was involved in that feedback. On the next slide, This is, so the very first, as I mentioned, we did an environmental scan, and this is kind of a roll up of the findings of that environmental scan. And what I'll say here is that I don't think any of these were surprising to anybody who's paying attention to health IT in Michigan. What we essentially validated is sort of what many of our stakeholders reported that they kind of knew, that that there has been incredible progress in Michigan from from the 2005-2006 era to now. There has been incredible investment and use of health information technology, but that the capabilities do vary widely. Some are much more advanced than others. It's not a level playing field across the state. And that has some to do with the availability of high-speed internet. We still see a digital divide throughout our state. We also see a divide in the size and the resources of an organization and their ability to share more data and to integrate that data into their clinical systems. So we were able to really validate that Michigan has made tremendous progress, but there is much more work to do. On the next slide, I'm going to start to get into these recommendations. Now, I want to preface that these are draft recommendations. They have not been, the report has not been finalized. And the other thing I really want to say is that these are not in any particular order. They are not in order of relevance or order of importance by any means. These are just 6 recommendations that are in the draft report right now. So the first one I'm going to talk about is about identifying champions and really empowering them to bring others along. So when we look at how innovations move across how innovations get taken up and utilized, there's almost always a champion involved. There's almost always a leader who can share their story, can share how the innovation has impacted them, their business, their practice, how it's really changed the lives of their patients or whoever maybe, or their end user of their technology. And so in this space, the HIT Commission at this point, the recommendation is to find a way and to do a better job at elevating those champions and leaders, providing a platform for them to share the information that they know, share their best practices, and really do all they can do to push forward for future innovation in our state. The second recommendation is about social determinants of health. And I know I've been able to participate a little bit in the presentations that you've had today. And so I know this was a topic of conversation. And this recommendation really reflects a growing concern in this in health IT across the US. And that is, we want to start capturing these important aspects that impact people's health. We know the data has, research and data have borne out that housing, food security, clean water, good transportation, healthy environments, safe environments, good childcare and education have a lot to do on health with your health outcomes. And so if this data is being collected in some way, there needs to be a standard for it to be shared and to be meaningfully used. And I know that that's something that's being worked on the national level. And this recommendation is really just a reflection that Michigan wants to be a part of those standards as well. On the next slide, very important to not only health IT, but all areas of Michigan's infrastructure is fixing that digital divide, looking for ways to address the fact that not everybody has the same access. And so certainly that will help both the consumers and providers with health IT investment and usage, but also many other areas of our state as well. So that was a big recommendation that certainly hinges on, other recommendations hinge on this one for sure. And then the next recommendation about increasing the availability and accuracy of timely data is pretty specific to the state's public health systems, something that we knew several years ago, but became crystal clear during and still now during COVID and the state's COVID response is how important our public health data is and how important it is to have a bidirectional exchange of that data. And so this recommendation looks at that, recognizes the importance of that, and looks for ways that we can utilize some existing investments and existing groundwork to elevate that data and make it appropriately shared. The next slide. These are the last two recommendations that are currently in the HIT roadmap in its current form. And this one, the fifth one, is a recognition that we need to grow from our traditional partners in the healthcare system to some new partners like social service organizations and human service organizations that will be able to provide data to address those social determinants of health. And in order to expect them to do that, there needs to be some sort of a technical assistance program. We're essentially asking organizations here to do something that they haven't done before, and to collect and share this data. And so developing a way or a structure to be able to have that done across the state in a way that is efficient is what this recommendation really addresses, making sure that there's support for organizations that want to participate in health information exchange. And then lastly on this list, but certainly not least, is to continue for the Department of Health and Human Services to build upon the tremendous investment we've made in the Michigan Health Information Network and continue to work together to identify ways that we can further both the work of the Michigan Health Information Network and the Michigan Department of Health and Human Services. So just continuing to make progress where we have made progress. I think this is my last slide, this next one. Yes, and so just where we are now, and I think I may have mentioned this already, but where we are now is we are getting stakeholder feedback. And I think on, don't turn there yet, but on the next slide I have the URL where you can get a copy of this report in its draft form. And we're still accepting stakeholder feedback. I'm still making adjustments and changes to the recommendations and the report. The next step is for the HIT Commission to prioritize, to accept and prioritize those recommendations. And then do the hard work where the rubber meets the road of implementation. And so that is really where, I think it is important for the Commission's work will certainly continue and will certainly need further input as well. And I think my last slide, yes, is where you can, some of my colleagues who can answer additional questions who have been working on this much longer than I have on this particular report. And then the URL for the HIT Commission website. I will tell you an easier way is to go to michigan.gov/MDHHS and then type HIT Commission in the search bar. So you can do it either way. And that is my presentation. I am so excited to be here today with you guys at the Connecting Michigan conference. I remember the very first one. Again, just aging myself, but so happy to be here and really thrilled to take any questions that you might have as well.
Hi.
Hi.
I'm back. We got some questions. Actually, Julie Lowry asked a question earlier on about the first health IT roadmap. And if you could speak to sort of like how that roadmap guided, how did that get us to where we are today? Have you used anything from the first roadmap was the question.
Oh, that's a great question because the roadmap was really foundational to the creation of the Michigan Health Information Network. It spelled out everything from governance to technical specs to how the state would connect to how others would connect. It was really sort of the playbook for how Michigan became on the cutting edge of health information exchange. So it was used well, and much of the vision of that document has really come from strong partnerships that have been forged after its creation. So yes, it definitely was utilized.
There is a follow-up question about MyHIN being in the recommendation number 4. and being spelled out in recommendation number 4. And if this will, why? Is it because we're amazing?
Yes.
Will this still be applicable if or when MyHIN becomes a QHIN?
Okay. So the reason why it's spelled out in number 4 is that some of our use cases already have been with the MyHIN use cases have been with the state's public health data. And so I think that recommendation is in its form right now. And again, these are in draft form and certainly could change based on stakeholder feedback. But it's really just a recommendation that that's how the state has moved some of its data already and potentially could do that again.
I know, I just want to say, as a representative for MyHIN in this space, MyHIN is not intending on becoming a QHIN. One of the entities under VPCQ and USQHIN will seek QHIN status under TEFCA. So it wouldn't be MyHIN. But it looks like we need some clarification for our stakeholders. Let's see. What is the relationship between MyHIN and MDHHS HIT Commission? Are we partners? Are we dependencies? Is there a reporting structure? I can speak about the governance structure within MyHIN, but this is a question for you.
Sure. So the Conduit to Care roadmap that was created 15 or so years ago really anticipated that MyHIN would be its own 501c3, but that there would be it would be a trusted partner of the state. And so at that time, there was a member of the HIT Commission that served on MyHIN's board. I believe that is still the case, though I don't know that I could say that 100%, Joanne. I guess I'm looking at you. But that the HIT Commission regularly gets updates from MyHIN and makes recommendations to the department based on that information that they get.
Right. And I know that within MyHIN, there is a governance structure called the MyHIN Operations Advisory Council that meets with the stakeholders that have signed our QD SOA, our trusted data sharing partners. And those recommendations from the governance structure go up to our board and over to the HIT Commission. So let's see. I don't know if we have any other recommendations. I have some recommendations. Should we list them here? I don't think we have any other questions. Let me just wait. Let's see. Okay, Beth, thank you for being here with us and for sharing this. When will we so what's the next milestone?
Yeah, that's a great question. Right now, we are looking at a HIT Commission meeting in Q1 of 2022, which seemed crazy to me, but yes, 2022, very soon. And I think that date may be out. I think it might be in early February, and I couldn't say for sure, but that will be when the HIT Commission, we are hoping that this report is in front of them as part of their business, that they accept that report and start the work of prioritizing.
Great. And those are open meetings, right? So I can go whenever. I'm going to go every time, going all the time. That's it. It's open meetings.
Absolutely. It is an open meeting. Anyone can participate.
Please, if you're a stakeholder in Michigan, please participate. Thank you, Beth, for being with us. We really appreciate it.